Okay, this is clavicle. The clavicle, this is the clavicle, this is the surface of the medial surfacing head of the clavicle, and this is the lateral surfacing head. This lateral surfacing of head is connected with scapula, uh, with the acromion surface, and it is formed the sternoclavicular, it is form the acromion clavicular joint, and this is attached with the sternum, the middle part of the chest, sternum. This is form a joint called as sternoclavicular joint. So if we see the clavicle will be like simply S shape, just like S. How can we how can we know the correct anatomical position of this clavicle? See here, this clavicle, this head is larger than this part. This is how you can be distinguished. This larger part always connected with the sternum part. The sternum, uh, this point will be remembered always. The larger part always connected will be sternum part. So if you hold it like this, like the larger part towards the sternum, then it will be automatically in the correct anatomical position. Then we will go to the scapula. Yes, another one. Here will be the anterior, here the this will the medial part, on the lower surface of the medial part and upper surface of medial part. There will be the ligament will be attached with here, which is connected with scapula, other things. Here will be the scapula. This is the anterior side of the scapula, and this is the posterior side of the scapula. As you see, the anterior side is slightly curved. Because here will be the rib cage, it will be just back side of the rib cage or posteriorly to the rib cage, so it will be curved like structure to cover like the rib cage. Now I am explaining what is the part of all of this scapula. Okay, the anterior and posterior, this is the posterior aspect and anterior aspect, and here will be the spine. Here will be the spine. The spine will be starting from dorsally, and it will be emergence forwardly towards, and here is the here will be the that is a head. This is called as acromion. Here this is the region where the clavicular that small head will be joined this region. This clavicular small joint, this one will be joined at this region. So at last I will show you the whole picture. Now you just remind. Okay, the spine will be like this, and this spine will be divided, the posterior side of the scapula, into two parts. Here will be the here will be the supraspinal spinous fossa, and here is the spinous fossa. Because it is present at the upper part of the spinous, so it is called as supraspinous fossa, and this is called as infraspinous fossa. Okay, this part of the scapula have mainly three borders. See, 1, 2, 3. If we correct position towards the correct anatomical position, then this part will be the medial portion, this part will be the lateral, and this part will be the superior. Okay, this superior, as it is superior border, here will be the angle is present. This is called as superior angle, and this is the part is called inferior, so this is called as inferior angle, as it is just look like a angle. And this small projection bone that is present here, it's called as coracoid process, and here it will be the acromion, where the joint of the clavicle, the small surface of the clavicle will be joint here. Okay, and this is called as glenoid cavity or glenoid fossa. you can call it glenoid. You are just call it anatomical, it is properly correct, glenoid fossa. Okay, this is the whole about the scapula. Here I will show you. Here this was the coracoid process. This is the proper image of glenoid cavity. Okay, this part is spine. This is the acromion, properly picture, see the picture, and this part is supraspinal fossa, spinous fossa, and it's the infraspinous fossa, and this is the body of the body part of mainly. Okay, now this one, see this picture, this is the glenoid cavity. As we told you, this is the acromion, sorry, this is the acromion, this is the coracoid process. Okay, this glenoid cavity is covered by some ligament that is called as the glenoid labrum. Okay, and this is the tendon of the head of bicep, and this is the tendon of long head of bicep brachii. Here will the bicep muscles will be attached. This is the ligaments. Okay, as we told you, this is, see the picture. Okay, this is the glenoid cavity, this is the acromion, this is the coracoid process, and see the clavicle will be attached with this. Okay, the clavicle will be attached with this with a ligament, acroclavicular ligament. This ligament is called as acroclavicular ligament, and this clavicle will be attached with a ligament here. This part is called a coracoid process. The clavicle is just attached with the coracoid process by two ligaments. This will be so much important. Probably remind you. Always remind this. Two ligaments. One is trapezoid ligament. Another is conoid ligament. One is trapezoid ligament. Another is conoid ligament. Just remind it properly. Trapezoid and conoid. Okay. This is the glenoid cavity, labrum, glenoid labrum. See this one, and this will be like this. Okay, and then I will tell you something. That one, you always be remind this. The formula, the MTB. M means muscle, here the B means bone. Here T is present in between the muscle and bone, and T is called as tendon. Okay, why I tell this formula, because this will be help you in future. Okay, in between the muscle and bone there will be tendon is present always. Why? This is this cavity glenoid cavity, I told you as before, this will be the glenoid cavity bone. This part is connected with the humerus, head of the humerus, and this is the muscle will be connected with the bone by tendon, so it will be the tendon. But here this part is called as what? This part is called as acromion. The acromion is connected with the clavicle, that is connected with the bone, that bone name is clavicle. Then so it is bone, and bone connection is connected by ligament. Here will be the another formula, BLB means bone always connected by ligament. This is the key point. Always remain this one. You will never be confused. Where is the tendon? That name is for tendon, that is for ligament. This will be the problem. So always remember, this is a bone, acromion, and there is a clavicle is present there. So bone and bone will be attached with each other by a ligament. Here is also clavicle is a bone, and acromion process also a bone, and here is bone and bone also connected as ligament, and here is with two ligament will be connected. The two ligament are one's name is trapezoid, another is canoid. Conoid ligaments, this much. The front, another one, the trapezoid will be must be in front, and the canoid is also in the behind of it, connected with this one.